The biggest question, especially patients who've never had surgery at all, is it painful? It's reasonable to consider this. I'm not going to tell anybody it's painless, but it's usually not as bad as you might think. I tell most of my patients that the first day is not bad. Days 2 through 4 are kind of where the peak of the swelling happens, and so that's when it's the most uncomfortable. Think of it more as annoying than excruciating. It's not something that you're super happy about, but it's also not miserable. Bruising is variable in patients. Depends on what techniques are being used and where the changes in the nose are happening. The more work done on the bones of the nose typically increases the bruising. There are certain factors genetically that make you more or less likely to bruise as well. And then the techniques of the surgeon can affect the bruising as well. We utilize a piezotome, which is like an ultrasonic scalpel that can cut through the bone as opposed to using the traditional hammer and chisel. And so that's typically much less traumatic to the patients and typically results in much less bruising, if any. Typically, I'll tell patients they have a 50-50 chance of having any bruising at all. And if it does occur, then it's usually resolves by 7 or 10 days. Taking things like bromelain, which is an extract from pineapple, as well as an herbal supplement, Arnica montana, can help lessen the severity and duration of the bruising. So we usually recommend our patients take that starting even before surgery through the end of any bruising if they see it. If by day 3 or 4 they don't see any, they're probably not going to have any bruising and they can stop the supplement at that point if they wish. There is some improvement with swelling as well. So until that is resolved to an acceptable level, a lot of times they'll stay on it until that. Nasal packing and nasal splints are very different things. The splints I use go inside your nose, on your septum, sandwiching the septum in place, preventing it from swelling too much or moving around during that initial 6-day recovery period until they come out. Now, TikTok is full of pretty scary videos of splints coming out. Typically the ones we use are much smaller and much thinner and much less dramatic. The splints I use are 1/4 millimeter in thickness. As long as they stay clean, you hopefully will be able to breathe around them. Now again, swelling peaks at 2 to 4 days, so that's when you're the stuffiest, but as long as you rinse with some saline to keep the dried blood and mucus out of there, you typically can breathe somewhat through your nose during the initial recovery period. Most people are surprised at how much congestion there is in those days 2 through 4, but there are things you can do to help. 1, start watching your salt intake prior to surgery. If you limit your sodium intake to less than 1,800 milligrams or even less than that per day, can make a big difference in how swollen you are both internally and externally during and after that first week of surgery. Sleeping a little bit elevated, just get your nose higher than your heart. You don't have to sit straight up, but get your nose higher than your heart to let gravity help you. That makes a big difference as far as how much swelling you get after surgery. If you continue to clean and rinse your nose, the saline like we instruct you to, it'll help keep things clean to help minimize the congestion in your nose. But yes, you can have some mouth breathing, so using a humidifier in the bedroom can sometimes be helpful to make that be a little less bothersome. Most of the swelling and the bruising resolves somewhere in the days 7 to 10 range, but there's a continuous slow amount of swelling that takes a long time to go away and just gradually gets better. I tell patients in general there's a steady decline of the swelling over time, but there are little bumps in the road. If you go eat a bunch of soy sauce or Mexican food, you're going to notice that your tip's a little swollen, whether that's at a month after surgery or 3 months after surgery. Obviously, it's less so at 3 months than it was at a month, but the same trend of ups and downs you notice with a general decrease over weeks to months, even up to a year. The first week is usually the most inconvenient part, not necessarily the most painful part.